So it's pretty clear that things like ChatGPT and other AIs are quickly going to take over tons of jobs and careers in the near future. Complex tasks that would take a human days or even weeks to complete can now be automated at the snap of a finger. What about things like healthcare or fitness? Does AI pose a threat to fields like physical therapy? Welcome back to the channel. I'm Dr. Nate, and today we're going to be doing something a little bit different. We're going to be asking ChatGPT some questions related to pain, injury, and physical therapy to see how quickly it's going to replace me and my career. So I figured we'd start with some easy questions and then slowly increase the difficulty of them. But let's see how it does. All right, so I figured we'd start easy and just ask it to give us a list. So maybe we can ask it to give us a list of the 10 strongest muscles. Let's see what it does. All right, it's thinking. Still thinking. Still thinking. All right, we're going. So number 1, gluteus maximus. Sounds pretty good. Quads, lats, pecs, traps, deltoids, biceps, triceps, abs, and soleus. That seems pretty legit. There are some muscles that I sort of expected to be on here that aren't. It did get soleus, which is one of your calf muscles. I sort of expected the other calf muscles, your gastrocs, to be on there too. And I also expected your jaw muscles, your masseters, to be on there. They're the muscles that help close your jaw. And pound for pound, they're one of the strongest muscle groups in your body. But maybe we can ask it. So let's say, what about your jaw muscles? Oh, here we go. The masseter and temporalis are the main muscles of the jaw. True. Both of these muscles are quite strong and used in a variety of everyday activities such as biting and chewing. Yeah, that's true. Why were they not included in the list? Let's see what its rationale is. I apologize for the confusion. The list I provided earlier was of the 10 strongest skeletal muscles in the human body, and the jaw muscles are not considered as skeletal muscles. Okay, so I guess it was defining it based on its own criteria. Masseter and temporalis are indeed 2 of the strongest muscles in the human body, yada, yada, yada. They were not included in the list because they are not skeletal muscles, but they are still important and strong muscles. All right, so it owned up to its mistake. So let's try another one. I'm going to ask it what I should do if I just rolled my ankle because the advice and evidence on this has changed over the years, so I want to see what it gives me. So I just rolled my ankle. What should I do? If you have just rolled your ankle, you should rest and elevate your ankle to reduce swelling. Apply ice to the area for 20 minutes at a time, several times a day. Over-the-counter pain medication. If you are unable to put weight on the ankle, you should seek medical attention. You should avoid activities that may aggravate the injury and consider physical therapy or any other rehab techniques to help the ankle heal. All right, so not too bad. It says if you just rolled your ankle, you should probably rest it a little bit, try to control the swelling, maybe take some over-the-counter pain medication or ice it if that helps with the pain and the inflammation. That is pretty good advice for the first day or so after an acute ankle sprain like this. The old school advice is RICE, so rest, ice, compression, and elevation, which can be helpful in the first day or so, but we know now that getting moving as quickly as possible after the injury and not holding on to RICE for too long actually has the best outcomes, but this is pretty good advice for if you just rolled it. It also mentions that if you're unable to put weight through the ankle, you should seek medical attention, and that is actually a really good suggestion. There's these rules called the Ottawa ankle rules that we follow. If someone sprains their ankle and they have pain in certain areas of their bone and they're unable to put weight on the ankle immediately after the injury and take a few steps, then they're more likely to have some sort of fracture rather than just a sprained ankle, and they should probably go get imaging as soon as possible. So I like that it put that in there. That's a point for ChatGPT. All right, let's move on. We're going to give it a tricky one. I'm going to ask it, does bad posture cause pain? So traditionally, your grandma and your grandma's grandma have passed down this idea that bad posture causes pain and that good posture will fix pain. But we've had a lot more research and studies on this topic in more recent years, and the relationship between pain and posture doesn't really exist like we thought it did. So let's ask ChatGPT and see how up to date it is on evidence-based practice. Bad posture can cause pain in various parts of the body. Uh-oh, here we go. Poor posture can put unnecessary strain on muscles and joints, leading to tension and discomfort. Maintaining good posture can help to alleviate pain and prevent further issues from developing. So I sort of expected a response like this from ChatGPT. It's probably read thousands of articles and blog posts about how posture causes pain and how getting into good posture will fix it. And this idea is still really common, so I can't really blame it for not being super up to date. But yeah, we really don't have any good research suggesting that people who have quote unquote bad posture are in any more pain than people who have quote unquote good posture. So that means you have permission to slouch. Don't listen to ChatGPT. All right, so next up, I'm going to see how well it can diagnose something. So I'm going to give it a collection of symptoms that relate to carpal tunnel syndrome and see if it can get it. All right, so I'm going to say that I have pain and numbness in my thumb and my pointer finger, and that I can only bend my pinky and ring finger. So what is wrong with me, ChatGPT? All right, it's thinking. It is possible that you are experiencing symptoms of a condition called carpal tunnel syndrome. All right. Carpal tunnel is a condition that occurs when the median nerve, which runs from the forearm into the hand, becomes compressed or squeezed. That's true. It is best to consult a doctor or a specialist to determine the specific cause and to receive the appropriate treatment. So this is pretty good, actually. Now, I'm not saying you should use this to diagnose your own injuries. I think that's a really bad idea. But if you had to choose this over just the general internet, this might be a better option. Remember, this thing pulls from thousands of different sources to figure out the most likely scenario that's going on. So it might be more accurate when trying to determine a specific diagnosis with a weird collection of symptoms. But yeah, it nailed that one. So another point for ChatGPT. So I'm going to give it another one that, based on the posture response, I can almost guarantee I'm not going to like, but we'll see how it does. I'm going to say I have low back pain. What should I do? So before we hit enter, I'm guessing it's going to give us a whole bunch of old school, outdated advice, but fingers crossed, let's see how it does. All right, there are several things that you can do. Number 1, stay active. That's good. 2, use heat and cold therapy. Maintain good posture. There it is. Good posture. Over-the-counter pain relievers. Consider physical therapy. Nice. Consult the doctor if the pain continues or it's severe. Okay, so I don't hate it as much as I thought I would. I love the first one, stay active. So staying active is probably one of the best things that you can do if you have a new episode of back pain. And sometimes it's kind of counterintuitive. It feels like when you're in pain, you should probably rest and stop moving, but staying active is probably one of the best things you can do. Use heat and cold therapy. So you definitely can if it's something that relieves your pain and allows you to move a little bit better, but probably not something you need to rely on or something that's going to make any lasting long-term changes. Maintain good posture. We already know, don't like that one. So make sure to stand and sit up straight. Yeah, don't listen to that. Just find a position that's comfortable and make sure to move into different postures and different positions rather than picking straight back, straight spine all day long. Over-the-counter pain medications, again, something you can do to sort of temporarily relieve pain, but probably not something you want to rely on. Consider physical therapy. I would say yes and no to this one. I think if the pain persists for multiple weeks and you feel like it's not getting better, might be worth considering PT, but most back pain isn't serious and is something that will go away on its own. Yeah, and again, its last point is really good. It's important to note that most low back pain will improve with self-care and on its own, but if your pain persists and becomes severe, you should consult a doctor. So overall, it's not terrible advice. There are probably a couple things that I would add to the list, like making sure you get good sleep, making sure you're managing your stress levels well, and finding some short-term pain relief strategies. If you're personally struggling with back pain, that's what I help people with, so head to backunbroken.com or check the link down below. All right, let's give it one more really tricky, nuanced, open-ended question and see how it does. So I want to ask it, how do you prevent injuries? There are several ways to prevent injuries. Stretching and warming up. All right, so I like the warming up part. I think that's important before engaging in any physical activity to make sure your body is ready for what you're about to do. I'm not so crazy about the stretching part. It's sort of like posture where it's been passed down for generations that stretching is something that you have to do in order to prevent injuries. And again, we really just don't have the research to suggest that that's true, but if it's something you like to do, then feel free. Using proper form. Okay, again, this is one that sort of seems obvious that good form form is probably going to lead to less injuries, but it isn't always that simple. Injuries are super complicated, but a lot of it comes down to how prepared your body is to do whatever you're about to do. So if you always practice a movement with quote unquote bad form, but your body's really prepared to do it, then you probably have a lower risk of injury than someone who uses quote unquote good form but isn't prepared to do it. So not crazy about that one. Wearing appropriate safety gear like helmets and pads. That sounds pretty important depending on what you're doing. Number 4, gradually increasing the intensity and duration of physical activity to avoid overuse injuries. That's excellent. So this is exactly what I was talking about with number 2. So a lot of injuries come down to doing too much too soon after too little for too long. So by gradually increasing the intensity and duration of your activity rather than jumping right into a certain movement or exercise, you're going to give your body more time to adapt and get used to whatever you're doing and have a lower chance of injury. Taking rest days to allow the body to recover. Good. Maintaining a healthy diet and staying hydrated. Pretty good. Maintaining a healthy weight and avoiding smoking, excess alcohol consumption, and other harmful habits. Investing in a good pair of shoes and orthotics if needed. I think it's important to have shoes that aren't super worn down or super uncomfortable, but I don't think they're a huge risk factor for injury. And finally, seeing a doctor or physical therapist if you're experiencing pain or discomfort. That's a good piece of advice. So it actually seems like ChatGPT is kind of on our side. It's not trying to push us out of business yet. It's recommending that you come see us if you're in pain, so that's good. So overall, it's a pretty good list. I think there's a couple things on there that are maybe a little outdated or not super important for preventing injuries, but it's certainly not a list that's going to increase your risk of injury. All right, so overall, I'm pretty impressed with what this AI could come up with in terms of advice and answers to my questions. Again, it wasn't perfect and it was a little outdated with some of the stuff that it said, but overall, it was pretty good. So let's go over a couple use cases or potential future implications for the field of physical therapy and healthcare using software like this. So number 1, I think it's going to be really helpful for difficult patient cases. So like we saw with the carpal tunnel answer, you can give software like this a collection of symptoms or pain or patient presentation, and it can spit out a most likely scenario. So I think something like this is going to be super helpful in the future for brainstorming potential diagnoses or potential reasons for someone's pain. The next thing I'm really excited about with software like this is its implications on research. So right now, the way we evaluate research is we have to go one by one reading through studies and systematic reviews to try to find what the evidence says on a topic. Pretty soon, I think we'll probably have software very similar to this where we can ask it a research question and it can search every database, every article, every systematic review ever made, and in 10 seconds can spit you out an answer to the question that you're asking. Unlike humans, it won't have any opinions or preconceived notions that cloud its ability to evaluate research. So honestly, I think tools like this are going to be super helpful for the field of physical therapy and healthcare as a whole. I don't think it's going to put me out of a job yet, and I think it's only going to help patients get better care. So overall, I think it's a big positive. So guys, thanks for watching. Make sure to like, subscribe, and I'll see you next video.